when we think about what we're trying to achieve here with the medicines, the first and foremost thing that we want to accomplish is getting you to feel better. And so your symptoms and achieving what we call clinical remission is the first primary treatment goal. From there, though, we know that there's a subset of people who will have symptoms come back down the road. They'll have symptoms come back, they may be more severe, they may be too severe to recapture with other treatments, and you may end up in the hospital or needing surgery because it just sort of gets worse. And so where we've gone to now is we've moved away from focusing just on clinical symptoms and now begun to think of disease remission as a layered approach, where symptoms are still important, but if we can achieve healing at the source of the inflammation, that really has been best associated with preventing you from having a flare down the road or having a bad complication down the road. And so what we've gone towards now is wanting to know that the inside lining of your colon or your intestine is actually healed, because there's a disconnect between you feeling well and the colon still having inflammation about 20% of the time. And then beyond that, we want to know that even though we don't visually see any inflammation, is there microscopic inflammation that we can see when we take samples that even further helps us prevent you from having a relapse or developing a complication down the road. So I think that's where these treatment goals are evolving. The patient and your symptoms are always going to be the number one priority, but everything else we do is to prevent you from coming back to the state you're in right now, where you're not feeling well.